What is your weakness?
I take great pride in my commitment to thorough documentation and ensuring every detail is accurate, as I believe this is crucial for maintaining high standards of care. However, I acknowledge that this meticulous approach can occasionally slow down my work process. To address this, I am actively working on improving my efficiency by incorporating time management techniques and prioritizing tasks more effectively. This balanced approach has already led to noticeable improvements in my workflow, allowing me to maintain the quality of care while enhancing my overall productivity.
What's your strength?
One of my greatest strengths is my ability to communicate effectively with patients and their families. This skill is crucial in nursing, as it allows me to explain complex medical information in a way that is easily understood, ensuring that patients feel informed and reassured about their care. I make it a priority to listen actively and empathetically, which helps to build trust and rapport. Additionally, my strong communication skills extend to collaborating with multidisciplinary teams, which ensures that patient care is coordinated and comprehensive. This ability to communicate effectively enhances patient outcomes and contributes to a positive healthcare environment.
What did you learn from the previous workplace that can contribute positively to our department?
In my previous workplace, I learned the importance of a patient-centered approach to care, which is an organizational value I hold in high regard. This approach emphasizes treating patients with dignity, respect, and compassion, and actively involving them in their own care decisions. I also gained extensive experience in teamwork and collaboration, recognizing that a cohesive team is essential for providing high-quality care. I learned to value continuous professional development and evidence-based practice. By staying up to date with the latest medical research and advancements, I was able to bring innovative practices to my team, which improved patient outcomes. Furthermore, I embraced a culture of safety and accountability, where every team member is responsible for maintaining high standards of care and promptly addressing any issues that arise. These experiences have equipped me with a strong foundation in delivering compassionate, effective, and safe patient care. I am confident that these values and practices will positively contribute to your department by fostering a supportive and high-performing healthcare environment.
Your colleague asks you to do something you are not confident to do. What's your response?
If a colleague asks me to do something I'm not confident in, I would respond with honesty and a commitment to ensuring the task is handled effectively. I might say, "Thank you for considering me for this task and for your trust in my abilities." To ensure it's done safely and to the highest standard, I need to be honest about my current level of confidence in this area. Could you provide me with some guidance or suggest someone with more experience who could assist? I'm eager to learn and develop my skills while ensuring that the task is completed correctly. This approach not only prioritizes patient safety, but also reflects my dedication to quality and my willingness to seek support and grow professionally.
The doctor is not coming to the hospital to review the patient. What would you do?
In the situation where a doctor is not coming to the hospital to review a patient, my primary concern would be the well-being and safety of the patient. First, I would assess the patient's current condition to determine if there are any immediate needs or signs of deterioration. I would document any changes in the patient's status and all pertinent information, ensuring that I have a clear and comprehensive picture of their current health. Next, I would attempt to contact the doctor directly, either through a phone call or a secure messaging system, to inform them of the situation and request their guidance on the next steps. If I am unable to reach the doctor, I will escalate the issue to the on-call doctor or another available physician, providing them with all the necessary information and asking for their assistance. Simultaneously, I would keep the patient and their family informed about the situation, explaining the steps being taken to ensure that the patient receives timely and appropriate care. If necessary, I would consult with my nursing supervisor or the hospital administration to ensure that all protocols are being followed and that the patient's needs are addressed promptly. Throughout this process, I would remain vigilant in monitoring the patient's condition and be prepared to act swiftly in case of any changes. My goal would be to ensure continuous and effective care for the patient while addressing the situation with professionalism and a sense of urgency.
How would you assess and manage care for a dehydrated patient?
Assessing and managing care for a dehydrated patient requires a thorough and systematic approach. First, I would conduct a comprehensive assessment to confirm the diagnosis of dehydration. This involves evaluating the patient's symptoms such as dry mucous membranes, decreased skin turgor, sunken eyes, hypotension, tachycardia, reduced urine output, and mental status changes. I would also review the patient's medical history, recent fluid intake, and any underlying conditions that might contribute to dehydration. Next, I would perform vital signs monitoring to detect any immediate threats to the patient's health, such as severe hypotension or tachycardia, which could indicate hypovolemic shock. I would also order or review laboratory tests, such as electrolyte levels, blood urea nitrogen, BUN, and creatinine, to assess the severity of dehydration and identify any imbalances or kidney function issues. Once dehydration is confirmed, the primary goal would be to rehydrate the patient and restore fluid and electrolyte balance. Depending on the severity, I would administer oral rehydration solutions for mild cases, encouraging the patient to drink small, frequent sips of water or oral rehydration solutions containing electrolytes. For moderate to severe dehydration, I would initiate intravenous, fluid therapy, starting with isotonic fluids like normal saline or lactated Ringer's solution. The rate of fluid administration would be carefully calculated based on the patient's weight, age, and overall health condition, and I would closely monitor for any signs of fluid overload. Throughout the rehydration process, I would continuously monitor the patient's vital signs, fluid input and output, and clinical response to treatment. I would also reassess their skin turgor, mucous membranes, and urine output to gauge improvement. It is crucial to adjust the fluid therapy plan based on the patient's ongoing needs and response to treatment. Education and prevention are also key components of managing care for a dehydrated patient. I would educate the patient and their family about the importance of adequate fluid intake, especially in hot weather, during illness, or following activities that lead to significant fluid loss. I would provide guidance on recognizing early signs of dehydration and when to seek medical help. Effective communication with the healthcare team is essential to ensure that all aspects of the patient's care are coordinated and that any changes in the patient's condition are promptly addressed. By following this comprehensive approach, I aim to provide safe, effective, and compassionate care for patients experiencing dehydration.
Ms. Mihiraa suddenly collapses in the bathroom. She had an unwitnessed fall. What would you do?
Upon discovering that Ms. Mihiraa has suddenly collapsed in the bathroom, I would first ensure her immediate safety and assess her condition. After quickly checking for responsiveness and ensuring that she is breathing and has a pulse, I would call for assistance from nearby staff and ensure the emergency response team is alerted. I would then initiate an immediate, thorough assessment of her condition, noting any visible injuries, changes in consciousness, and any immediate life-threatening conditions. Simultaneously, I would ensure the scene is safe for both Ms. Mihiraa and myself, removing any hazards that could cause further harm. Once help arrives, I would provide a concise and structured handover using the ISBAR framework. I would identify myself and the patient, explaining that Ms. Mihiraa had an unwitnessed fall and detailing her current condition. I would describe the situation, explaining that she was found unresponsive in the bathroom and providing any relevant background information, such as her medical history, recent medications, and any known risk factors for falls. I would assess her condition, mentioning any visible injuries, vital signs, and her level of consciousness. After this, I would recommend immediate actions, such as stabilizing her cervical spine if a neck injury is suspected, preparing for possible transport to a higher level of care, and ensuring she receives a thorough medical evaluation. Finally, I would reiterate the need for continued monitoring and suggest further diagnostic tests, such as a CT scan or blood tests, to identify any underlying issues that might have caused the collapse. Throughout this process, I would remain calm and focused, providing reassurance to Ms. Mihiraa if she regains consciousness, and ensuring that all actions taken are in her best interest. Communication with the healthcare team would be clear and precise, ensuring that everyone involved is fully informed of her condition and the steps being taken to provide care.
Mrs. Mihira's daughter told you that she had been unwell and more confused before this incident. What would you do?
In addressing Mrs. Mihira's daughter's concerns about her mother's prior health, it's crucial to methodically assess the situation using a structured approach. Firstly, I would start by gathering all pertinent information regarding Mrs. Mihira's condition before the incident. This involves understanding the specific symptoms she exhibited, such as the extent of her confusion and any other signs of illness. Once this information is collected, it is essential to assess its significance in relation to the current incident. For instance, if Mrs. Mihiraa was displaying increasing confusion and other symptoms that were not previously documented, this could indicate a progression of an underlying condition or a new issue requiring attention. After evaluating the details of Mrs. Mihira's prior health, I would then communicate these findings to the relevant healthcare team members. This would involve presenting a comprehensive overview of Mrs. Mihira's pre-existing symptoms, how they have evolved, and their potential impact on her current state. By providing a clear and thorough account, the team can better understand the context of her current condition and tailor their treatment approach accordingly. Furthermore, it is essential to ensure that Mrs. Mihira's daughter feels heard and informed throughout this process. Addressing her observations and concerns with empathy and clarity not only helps in managing the patient's care more effectively, but also supports the family during this challenging time. This thorough and compassionate approach will ensure that Mrs. Mihiraa receives appropriate care based on a complete understanding of her health history and current needs.
You heard your colleague shouting at the patient and asking to get out. What would you do?
In responding to a situation where a colleague is shouting at a patient and demanding they leave, it is essential to address the issue with both immediate action and a commitment to resolving any underlying concerns. Initially, I would intervene directly to stop the inappropriate behavior, ensuring that the patient is not further distressed. Approaching the situation calmly but assertively, I would address the colleague privately, away from the patient, to discuss their conduct. It is crucial to express concern about the impact their actions may have on the patient's well-being and to emphasize the importance of maintaining professionalism and respect in all interactions. Following the immediate intervention, it would be important to document the incident accurately and comprehensively. This documentation should include the details of what occurred, any observations about the colleague's behavior, and the patient's reaction. Such documentation is vital for ensuring that there is a clear record of the incident, which can be referenced for any necessary follow-up or review. In addition to addressing the situation with the colleague, it is important to follow up with the patient to ensure they feel safe and supported. Offering a calm and empathetic conversation with the patient can help to reassure them and address any concerns they may have about their treatment. Finally, reporting the incident through the appropriate channels is crucial. This might involve informing a supervisor or the relevant department within the healthcare facility. Reporting ensures that the behavior is reviewed and that any necessary corrective actions are taken to prevent recurrence. By addressing the situation thoroughly and transparently, the focus remains on maintaining a safe, respectful environment for all patients and upholding the highest standards of care.
The ambulance arrives with a known diabetic patient. The reason for the presentation was an altered level of consciousness, nausea and vomiting, high blood sugar levels, and breathlessness. How would you manage the clinical care and prepare for the retrieval of this patient?
Upon the arrival of the ambulance with a known diabetic patient presenting with altered consciousness, nausea, vomiting, high blood sugar levels, and breathlessness, it is critical to conduct a systematic and thorough assessment to manage the clinical care effectively. The initial step involves quickly yet carefully evaluating the patient's vital signs and overall condition to gauge the severity of their symptoms. This assessment should include measuring blood glucose levels, checking oxygen saturation, monitoring blood pressure, and assessing respiratory rate and effort. Given the patient's altered level of consciousness, it is essential to ensure their airway is patent and that they are adequately breathing. If the patient is unable to maintain their airway independently, appropriate interventions such as airway positioning or support may be required. Concurrently, administering supplemental oxygen can help address any breathlessness and ensure adequate oxygenation. For the elevated blood sugar levels, It is crucial to evaluate whether there is any evidence of diabetic ketoacidosis, DKA, or hyperosmolar hyperglycemic state, HHS, as these conditions could be contributing to the patient's symptoms. This involves checking for ketones in the urine if possible and reviewing the patient's medical history to identify any recent issues that might have led to these high blood sugar levels. If DKA or HHS is suspected, treatment should include intravenous fluids to rehydrate the patient and insulin therapy to lower blood glucose levels. Electrolyte imbalances should also be monitored and corrected as necessary. Nausea and vomiting may exacerbate the patient's condition and lead to dehydration or electrolyte imbalances, so managing these symptoms is also important. Antiemetic medications might be administered to control nausea and prevent further vomiting. Preparing for the retrieval of the patient involves ensuring that all clinical information is documented accurately and that the patient is stabilized as much as possible before transport. This includes coordinating with the retrieval team and providing them with a comprehensive briefing on the patient's condition, treatment provided, and any ongoing concerns. Ensuring that all necessary medical records, medication lists, and other relevant information are readily available for the retrieval team will facilitate a smooth transition of care. Throughout the process, effective communication with both the patient and their family is essential to provide reassurance and ensure they are informed about the steps being taken. By managing the patient's condition with a focus on stabilization and preparing thoroughly for their retrieval, the transition to further care can be conducted as smoothly and safely as possible.
You are administering medication. How can you demonstrate medication safety?
Demonstrating medication safety during administration involves several crucial steps to ensure that the patient receives their medication correctly and without harm. First, it is important to follow the 5 rights of medication administration: the right patient, the right medication, the right dose, the right route, and the right time. Before administering any medication, I would verify the patient's identity using 2 identifiers, such as their name and date of birth, to ensure that the medication is being given to the correct individual. Next, I would carefully review the medication order, including the drug name, dosage, frequency, and route of administration, to confirm that it matches the prescription and the patient's current medical needs. Checking the medication label against the order ensures that the correct medication is being prepared. Additionally, assessing the medication's expiry date and checking for any visible signs of deterioration, such as discoloration or particles, is essential for ensuring the medication is safe to use. Prior to administration, it is important to explain the medication and its purpose to the patient, addressing any questions or concerns they may have. This not only helps in obtaining informed consent, but also ensures that the patient is aware of what to expect. During the administration, I would adhere strictly to aseptic techniques to prevent contamination and infection, such as hand hygiene and using sterile equipment. Monitoring the patient for any immediate adverse reactions or side effects after administering the medication is another critical aspect of ensuring safety. Documenting the administration accurately, including the time, dose, and any observations, provides a complete record of the patient's treatment and facilitates continuity of care. Furthermore, it is important to ensure that the patient's medical record is updated with the new information regarding the medication administered. This includes noting any changes in the patient's condition that might impact their ongoing treatment plan. By following these procedures meticulously and maintaining open communication with the patient, I can demonstrate a commitment to medication safety and contribute to positive patient outcomes.
An elderly patient with limited family support is admitted to the ward following a mild CVA. How would you plan for his discharge?
Planning for the discharge of an elderly patient with limited family support following a mild cerebrovascular accident, CVA, requires a comprehensive and patient-centered approach to ensure their safety and well-being upon leaving the hospital. The process begins with a thorough assessment of the patient's medical condition, including their current functional status, cognitive abilities, and any ongoing needs related to their recent CVA. Understanding their level of independence and any physical or cognitive impairments will help tailor a discharge plan that addresses their specific needs. Given the patient's limited family support, it is essential to involve a multidisciplinary team to provide a robust support network. This team might include social workers, case managers, and community health professionals who can assist in coordinating care and arranging necessary services. Key aspects of the discharge plan would involve setting up home health services if required, such as nursing care, physical therapy, or occupational therapy, to support the patient's recovery and rehabilitation at home. Arranging for appropriate home modifications or assistive devices might also be necessary to ensure the patient's safety and facilitate their daily activities. This could involve installing grab bars, arranging for a walker or wheelchair, or making adjustments to the home environment to prevent falls. Additionally, considering the patient's nutritional needs and arranging for meal services or assistance with meal preparation can be crucial in supporting their health and recovery. To address the patient's potential need for ongoing medical care, ensuring that they have a clear understanding of their follow-up appointments and medication regimen is important. Providing written instructions and contact information for healthcare providers can help the patient adhere to their treatment plan and seek help if needed. If the patient is managing medications, organizing a medication management system or coordinating with a pharmacist to review and organize their prescriptions can enhance adherence and safety. Finally, connecting the patient with local support groups or community resources can provide additional social support and reduce feelings of isolation. These resources might include senior services, community centers, or volunteer organizations that offer companionship and assistance. By addressing these aspects thoughtfully and proactively, the discharge plan can be tailored to support the patient's transition from hospital to home, ensuring they have the resources and support necessary for a safe and effective recovery.